Go ahead. Hey, Lindsay, I am super excited to have you here. I mean, I was there when you first got started with your business. So, for everyone else that's listening in, I'd like you just to explain where you're at now, what you're doing, and what that looks like. And then I have some other questions for you.
Okay. So I started a company called Living Solutions Plus. We provide mobile outpatient therapy, both physical and occupational therapy services. And then on top of that, we do the home assessments and modifications portion also. We're based in Michigan, north of Detroit, and I'm a COTA. So it's been a unique challenge, but it's definitely been very rewarding, and I've really enjoyed it so far.
Yes, I remember some of those unique challenges, but I think I'm just going to start with a few questions because you did our home mod certification course, and it was really interesting just working with you in that and thinking about the role for CODA in this. But what inspired you to actually get down into the home mods area?
Yeah, so I, after I graduated, I was working in the rehab unit of a local hospital over here. I saw kind of a significant amount of seniors with injuries from falling at home. So I started to think about how those injuries could have been prevented instead of just managed. And then from there, I just kind of decided that the best way would be to open up my own practice that would ensure fall prevention for seniors. And I found your program, and it kind of just snowballed from there.
Yeah, so there's obviously been a few hesitations, misconceptions, and things that happened. And I'm sure one of them is that you, as an OTA, could not have your own business doing this. But explain a little bit about those and then what changed for you.
Explain
A little
the
bit about some of those hesitations and misconceptions you had before you got started in home mods and then how that changed.
Oh, okay. So I would say the biggest misconception is that OTAs can't start their own business. We definitely can. I'm living proof of that. I mean, you obviously need to have an occupational therapist to do your client evaluation, but as a CODA, we can definitely um, do the actual home evaluation. So, with that certification and training, I was able to really be able to get more involved in that and really have the training necessary. And then just one misconception about home modifications in general is they aren't always about gutting and completely redoing a room, which I have found. I've had many clients who just need the tools to navigate their home properly. They don't necessarily always need a construction project, although I have done those and those are interesting too. But for example, I've recommended safer shower seats, bath mats, grab bars, raised toilet seats, just to keep people safe in the bathroom. And then without the need for a completely new shower, because not all of them need it. But sometimes it's just like the small, thoughtful adjustments that make the biggest difference. So.
And that's really true. I mean, I found that in my own practice. Very few of them were really architectural changes or big changes. But also, that's what the research is showing from the older adult home modification grant and all of those things, that those small things can make a difference. But it's our unique OT lens that lends that, right?
Yeah, absolutely.
Yeah. And obviously you've developed the skills in that area. But I think our certification program also helped you with that, right? And gave you some more confidence. So tell me a little bit more about how that helped you and where that led you.
Um, like how I use my certification or
Yes, yeah.
so being in the program has really allowed me to clearly communicate my expertise to potential clients and their families, um, and referral sources too, which really helps build trust and credibility in the industry. So I use that kind of like an educational tool when I'm networking with physicians, senior communities, different community organizations. It just highlights how environmental modification can prevent injury and improve daily function. So that's been how the certification has really helped me to grow the business and reach new people. So,
Yeah, where are you getting most of your referrals from?
um, let's see. Honestly, I go straight to where seniors are. So community centers, I do presentations there on safety and exercises and things. And then I go to different like AFCs, adult foster homes, assisted living, and I work with a care manager who works in the court system to keep people safe too. So it's been definitely interesting in that way.
That's really interesting how you put all that together for your community. And so, for someone who is wanting to move into this area, what kind of advice would you give them?
Let's see. I have a lot to say on what kind of guidance or advice. But first, I would say that remember that the home is deeply personal. You're stepping into someone's private space, their routines, their history. Make sure you're taking the time to listen before you make any recommendations. Understand how your client moves through their day, what tasks matter most to them, what concerns they may have about change, and then the best recommendations come from observation, and collaboration with the client and family. So, um, another thing is you want to think about function before renovation. Because home mods aren't always requiring major construction, they do often need small adjustments like improve lighting, rearrange furniture, grab bars, adaptive equipment, that sort of thing, because it all makes a significant difference. We really want to focus on reducing risk while preserving independence and comfort. Um, and then you really want to develop a systematic assessment process. So looking at entrances, flooring, lighting, bathroom safety, stairs, and pathways with very clinical eye. Um, you want to consider the person's balance, strength, cognition, endurance. And then when you approach the home with that structure and intention, your recommendations really become a lot more confident and defensible. So you can explain to them, why you're telling them what those recommendations are and why they need them. And then I would say lastly, it's important to build a network. So connect with contractors, handymen, providers of DME or durable medical equipment, and any other professionals who understand accessibility and why that's important. Really having trusted resources ensures that your clients receive safe and quality environmental changes. So.
Yeah, that's really good. I mean, because you're balancing your clinical judgment with the client's priorities, goals. And like you said, home is really personal. And I think you've really debunked the myth that home mods and home safety as you age in place require all of these major architectural changes, which is definitely, as you've said, not true. And as we see from the literature, um, one of the things, though, and I think is unique in your situation, is working with your OTR as you make those recommendations and building that trust and getting that check off skills list. How did you go about that piece? Because, you know, that's unique in that sense, right? Because you're coming back to them and working with the goals and the plans. And
Yeah, I mean, they're there with me every step of the way, but because I'm the one who is, doing the home modifications, and making those recommendations, it's kind of on me with their support. So they will, they take a look at the client and everything they need, but and then they make the goals. When they know that there's a home environment change that needs to be made, they make goals with that in mind. So then I will work to make those changes, and I will work to make sure the goals are met. And that's kind of how we collaborate. And sometimes they'll make their own recommendations also if I don't think of something, but it's good to have that team collaboration so we can support each other.
Yeah, that's really perfect. And it's great how you have that set up.
Mhm.
Definitely. And as you were establishing that relationship, did your certification help with demonstrating to your supervising OTR that you had the skills and that this was a special area that you could contribute?
Yeah, I think so. I mean, I think because I started the business, they are more apt to trust me and my judgment too. Um, I mean, the certification definitely helped with that. And then just the fact that I started my own business from the ground up with those skills, I think really helps with the trustworthy piece on that too.
Yeah, and I think what you're um, illustrating out there is that being a business owner and being the boss is a different role from being the occupational therapy assistant working with the OTR,
Mhm.
right? But
It's a
you've
balance.
managed to merge both of those, but it does take stepping into those different roles, right?
Yes, it does.
Mhm.
Absolutely.
Yeah. And I think that's why it's clear that an OTA can definitely own a business, right? The business owner role is very different to now I'm an occupational therapy assistant working with an OTR. Um, when you were looking for certifications or things to build up your skills, what made you look at our certification?
Um, well, I really wanted to find the best way to help my clients, um, while providing that professional point of view. Um, I really wanted to strengthen my clinical judgment and my confidence in recommendations, once I started the business. So I was kind of going through starting the business as well as getting
Doing the certification.
certification. So it was a lot to go
I
through.
remember helping you with all.
Yeah.
Yeah.
Um, so I really, I wanted to kind of hit the ground running, which is why I put so much on myself at that time. But it was definitely worth it because I can now approach each home with a structured assessment process. Everything's evidence-based. The program gave me a ton of knowledge, so that I can clearly explain safety concerns, which is really important. The clients and families need to know what the solutions are. It increases their trust and engagement in the process. And then, it really has enforced the importance of balancing safety with independence. So, um, a really big thing I wanted was to be able to recommend modifications that reduce risk without making the home feel like institutional or overwhelming. So a lot of my clients I've found as a result feel empowered rather than restricted, which has been great. And I think families feel reassured knowing that my decisions are grounded in, professional training and best practice. So it's really followed through on I've been able to follow through on what my goals are, which is great. So
Yeah, and you've been doing this, what is it, 4 years now?
I just hit 3 years
Okay.
a few days ago. Yep.
Yeah, and congratulations, you've done a good job with that. What advice would you give to someone else starting out? Someone said she'd like, Alyssa would like to know how you got started and how did you get the business off the ground? And we had to go through the whole Medicare credentialing process and get yourself set up with all of this. I remember that.
Mhm.
And we'll talk a little bit about payment sources in a minute. But I really want to just say, what advice is the first thing you would give people wanting to set up this kind of a business?
Don't give up. Especially with the Medicare process. Um, and especially as an OTA, I mean, that was extremely brutal. Trying to get approved because they would not approve me without having a licensed occupational therapist, um, you know,
That would
with
be on board with you,
connected to the
yes.
exactly. So
Yes.
yeah, don't give up because you're gonna have those challenges, but you will get through them, I promise. Um, just keep working, and, have faith in yourself that you can get the job done, that you can, that you know what you're doing, and that once you get through those administrative hurdles, you got this. So, and then, people like Sue are out there to help you, with all that, Medicare enrollment, stuff too. So.
Well, and even the coaching that comes with the chat certification helps with that as well as those other pieces. So definitely. Um, I want to, before we go any further with my questions, we have four people here. Melissa has that one, but I thought if anybody else has questions they want to ask or comments that they want to give Lindsey, please go ahead now and unmute yourself. And I see Rita rushed in there.
I was trying not to do it too fast.
You're good, Rita. Go ahead.
So, hi, Lindsay. It's been a while since we spoke, and I kind of had to put everything on hold because I didn't have a van. I think I told you I was in a wheelchair. Anyway, um, yeah, my thing is from the ground up. So, I started doing everything I needed to do. I took the certification. I was getting really excited, got all my ducks in a row, sort of like halfway there, until I realized there was a very big challenge in me hiring an OT. And so my question to you is, okay, I'm starting off fresh. Maybe I think I have like two clients that want to work with me right now. And so how do I how do I get like how do I seek out an OT not knowing if I'll be able to even give them any hours? That's the weird part, like how do you solicit that? Like how do you explain that when you're hiring?
Yeah, that's really hard. Um, I would just say be honest on exactly what you're looking for. I posted on Indeed,
Okay.
and I just under my job description, I told, the job seekers out there, hey, I'm a new business. I'm looking to grow. This would be a PRN position right now. Um, but I really need someone to help me grow this business.
Okay.
Just be very clear about what you need from them. And
Okay.
I know that's hard in the job market right now, because
Yeah.
everyone wants to do that, but um, I've also found that social media can help. I don't know if you're on LinkedIn at all, um,
Yeah.
or if you have Facebook, if you have a Facebook group for your business, that can be really helpful if you can post on there.
Okay.
Invite friends, have them invite friends to your business page, and then from there, try to get those posts up to try and get people to notice that you're hiring, that you need that support. There's
Okay.
groups you can get into on Facebook also. There's,
Mhm.
for example, in Michigan, there's a mobile therapist group. See if there's one in your area.
Oh, okay.
Yeah. Really get out there and and socialize and network with different therapist groups because that
Mhm.
word of mouth is going to be a really great way to get people hired.
Yeah, the hard part
Rita,
about
I'm happy. I'm
I'm sorry.
happy for you to post. I'm happy for you to post it in our Facebook group too.
Oh, thank you. Yeah, and I guess that led me to like partially the telehealth part. Like,
Mhm.
with the way telehealth is now, the possibility of maybe getting somebody via telehealth. But I'll talk to Sue more about that. I wanted to just basically direct my question to you on how you got started. I'm trying to solicit, not solicit, I hate that word, but in quarter two, my goal is to really get out there in the senior community and really go into assisted livings and speak to case managers and I know some people already, so that's my quarter two goal, like getting people maybe excited about it and then also trying to hire at the same time. So yeah.
That's a great plan. Yeah.
Well, thank you. It's somewhere to start.
Yeah, absolutely. And I would say that networking to hire and networking for business can be a little bit different because you're
Yeah.
talking to different people. So just keep working at it. You'll get there.
Okay.
Yeah.
Well, thank you.
You're welcome.
Um, Brittany has a question that she's posted in here. She said, "How is your business structured, the mobile outpatient side versus the home safety home mod side?" And I think as part of that, let's just talk a little bit about the range of clients that you're serving and some of your payment sources, since we're in that route.
Okay. So I started out only with Medicare patients, um, but and only with occupational therapy and home modifications. So that um, that was just like the beginning to it. And then eventually I networked and met a physical therapist who wanted to join. So I added that on as well. And then I just kind of started to run into some Medicare issues with a lot of people have Medicare Advantage, and some insurance companies like Blue Cross Blue Shield won't even let you bill to them if you're not part of their network. So I started getting credentialed with a bunch of different insurances so that I could accept more Medicare patients and help more people. And then that kind of snowballed into accepting commercial plans also. And then as far as the structure, I mean, I bill my home modifications. I don't know if any of you use Hello Note, but I bill everything through Hello Note and a Novolon. So essentially, you write your note, you bill it, um, and I bill all my home modifications as ADLs. So does that help you, Brittany? If you need more details, I'm happy to answer anything else.
I have a question just as far as how you said you do the mobile OT. I think that's kind of what she was maybe saying too. Like, do you go out and have the OT do an assessment with the patient and then from there decide if you're just doing, therapy with them and giving them a home exercise program and doing things like that? Or do you automatically start? I mean, I know as OTs, we're going to look at the home and the environment also, but I mean, are those separate charges? Are you automatically looking at the home when you're going to say just start therapy with the
Oh,
patient?
see what you're saying. Okay. So yes, so the first thing we do is get an evaluation. That's always going to be number one, no matter if we're doing home modifications or not. Um, the client and their family, once they'll before the evaluation, I always talk to them and I always tell them what we can do for them. And then during the evaluation, they kind of let the OTR know what their goals are. If if they want home modifications, I will recommend lots of different things to them. If they don't, then we'll just work on whatever it is that they they need to improve on. So, um, and I think you said something about
I'll
billing.
handle that one with the billing stuff. So,
Okay.
Alyssa, in the certification course, we go through how to bill, but it's really covered under the OT codes relating to the task that you're addressing. So, using those same CPT codes. And we also go through in the certification course when it's private pay and when it's not covered under Medicare. So there's certainly circumstances, and Lindsay, I don't know if you've done any private pay, but I've done multiple. So there's certainly circumstances when it isn't a covered service. And so when we do private pay, and so understanding that it's not medically necessary and when we can do that is really important. And I think you have that flow sheet as part of your procedure manual, right, Lindsay, with
Mhm.
that piece.
Yeah,
Yes.
absolutely. Yeah, for example, if someone is in a skilled nursing facility and they call you, you cannot bill insurance because they are already on a Medicare Part A. So I had a client a few months ago who they want she it was tricky because she was in a skilled nursing facility and her family wanted her to go home with, a whole new bathroom and everything. And they had already started working on that. But in order to do the evaluation, we had to do private pay because, um, it, Medicare would have kicked us out, kicked back and not, wanted to uh, pay on that. So we did a private pay case, um, and we did the evaluation, and then we had met her, and then we went to the home and we made sure that all of the changes that were taking place were correct. So there's a few, there's a bunch of different ways you can do it. It's as long as you're following the flow chart, you should be good. So.
Right. Do we have other questions? Feel free to ask those. And Lindsay, I'm just so proud of you sticking with it, even though initially it was a little tricky and where you've come. Um, Brittany was asking, is the flowchart part of the chat certification course? Yes.
Mhm.
Yeah. And so is the discussion about billing and those components as well, about when we need to bill, not bill, how to bill that. And we're updating some of the new information with the new telehealth changes and stuff too. Tamika, do you have something else you want to ask?
Yes. Great job, Lindsay. I'm really glad that you're doing so well. How
Thank
do
you.
you feel like your relationship with contractors is going? Do you have your own set of people, or how do you work that out with the clients? Do you just help them determine what to look for in a contractor, or what do you do with that portion of it?
I like to tell people because I don't want to get sued, right? If something goes wrong. So I always tell people look at three different contractors at least for quotes and to see what they can do for you. I do have companies that I work with. There's a great one around here that's been, doing this sort of work for a long time. So I trust them a lot, but I, I never give just one company name out because of the liability. So I usually give a few, or I tell them, here's a couple that I think are good. You should also get quotes from other people. And then once all of that is set up, then I'll work with whoever needs to be worked with.
And we
Okay,
have a
great.
section on that in the chat certification that goes through some of the risks and liability issues and then has a brochure that you can give your clients on how to choose a good contractor. So, Lindsay, I'm proud of you because you followed that to the T.
Yes. As a
Yes.
business owner, that's very important, I think, to make sure you're protecting yourself. So,
Yeah. Because it's very different insurance when you're looking at contractors and, even some of the agencies I've worked for, if the case managers have recommended a contractor and something's gone wrong, the agency, such as our local Developmental Disabilities Administration, has been sued. So we have some discussions about that and some of the ethical issues in one of our chat courses. So being cautious about that versus having a different liability insurance is really great that you've implemented that in such a good way.
Yeah, thank you.
Is this answering questions, everybody? Does anyone have anything else?
I have a question. With the mobile OT part, like, do you see patients solely in their homes, or do you see them in different environments?
I only see them in their homes. I know that there are therapists out there who see patients in the community, which I think is what
Mhm.
you're getting at.
Yeah.
Sometimes in assisted living, I will bring them into different areas of that assisted living home. Like I worked with one patient on, wheelchair management to get a haircut and things like that. But that has not been an extensive portion of my business. No.
So one of the things to think of, Alyssa, when we talk about that is when we're working with clients who are covered under Medicare or even Medicare Advantage plans, it covers two places, patient's home and your clinic or office. And so community reintegration, anything outside of the home, isn't a concern as far as a covered service from Medicare's perspective.
Mhm.
So if you did that with a client and a client had those values, then that would have to be a private pay service. Unless, for example, you rented something in a facility such as a gym or a pool, then there are some regulations for that. And you have to have a lease and you have to have that perspective credentialed with Medicare if you wanted that covered under that. Does that help explain a little bit more?
It's been, I mean, I guess I live under a rock. I do live in a very rural, underserved area, but so the whole mobile OT thing has been intriguing to me, and so I've just kind of started reading more about what people are doing and things like that and how it's working because we do have home health here, but I mean, home health is getting to where they won't even. I mean, they don't even take Medicaid patients here anymore, and they discharge patients so quickly and then patients don't want to be held up in their home. I mean, church is a huge thing here. People go to church all the time for things, and they don't want to just be able to leave to only go to the doctor and seek medical care and stuff. And they want to be able to get out and go to the gospel singing in the square with family and stuff like that. And so, but yet it's hard for them, to find somebody to bring them to therapy all the time because I work at an outpatient clinic also. I contract there. So I just am starting to kind of explore who it would benefit and how it would work and things like that. So,
Yeah, absolutely. I mean, have you started your own practice?
well, really, what happened was I do have my own company now. I set up an LLC. I contract as an occupational therapist for the local rural hospital, inpatient and outpatient. And then I also contracted with the development district here, and I did the OHEMP program, the older adult home modification program.
Yes.
And so that's where and I've always been interested in home mods because I live in such a rural area. And a lot of people don't even have family left anymore or this and that. And we were discharging them from the hospital and they were going home with no resources and equipment or anything. And it was just devastating to me. And so I was reaching out, trying to find out if there were places that would donate stuff or, any of this thing. Well, you have to be careful with that, And so, the OHEMP program really opened my eyes even more. And I was like, okay. And I mean, just how the smallest changes benefited these seniors so much and just changed their lives, really made them feel so much more confident in getting around their house. And so I'm like, oh, I really want to do it. So I've done the chat certification. I have, however, not done obviously all of your, I guess, weekly or monthly meetings or whatever, because I was so busy. But so I
I would
really, but I do
I
have
would
the LLC now and I want to do more with it. So I'm just
I
trying
would
to figure out.
yeah, I'd be happy to meet with you free for a half an hour and looking at that, but I would also
Okay.
recommend you join our home safety pros. It's $25 a month, but there's so much. Rita can speak to that. Lindsey, did that for a while. I can't remember if you're still in there, but we go through so many things, building your business, cases, we do problem solving, we do all kinds of things there. So that would be really a beneficial way as well. But I'm happy to meet with you to give you some next steps. Uh,
Okay, that would be awesome.
Feel free to reach out. Yeah. Lindsey, anything else that you could add that would help Alyssa that you think there?
Um, yeah, I mean, as far as getting clients, and you said that at church is really important to,
Here, yeah.
okay, so I would definitely go, and I've done this before too. Go talk to the pastor or whoever. I'll see if they have any meetings or if they would be willing to schedule like a presentation for you so that you can go over what you do, how you can help people, and then give them some tips on home safety. And that can really open doors for you. Because as soon as I tell people I go to their home for outpatient therapy, like their minds are blown. They
Mhm.
don't know what that is. They just get very excited about it because they want therapy. They want to be able to engage with their community, but they can't always get to a clinic, or
Mhm.
clinics maybe aren't in a rural area. So
Mhm.
I think that's a
That's
good opportunity.
that's definitely the issue here. I mean, we do have our tech, which is if they have Medicaid, and they don't own a car, that they can get to our clinics, but I mean, it's difficult, and they have to schedule 72 hours in advance, and it's just, and if they own a car but can't drive it, they can't access the service. It's crazy. And some of them own a car so that if somebody can drive them somewhere, they have a car, you know? So it's just it's kind of crazy. Well, we have adult daycares, actually one really close to the clinic I work at. We have adult daycares, we have senior citizen centers. Every county here pretty much has a senior citizen center. So there's lots of places to go and and talk to them about things. But I first feel like, first I have to have everything lined up and stuff.
Yes,
So
yeah, we'll need to talk to that. But even
yes.
even if the home health agencies are not keeping them long and they don't offer Part B services, then they could also be a good referral source for
That's
you as
true.
well, right? This client can't get to an outpatient center, still needs therapy, but doesn't qualify for home health. They're
Yeah.
wanting to get out to all of these other things. So there's definitely options there. The key is making sure you're getting set up right to be able to do that.
Yes.
And as you learn with the older adults, Home Mods grant, again, Home Mods and home safety doesn't need to include big architectural changes. Sometimes it
Mhm.
does need those, but not always. And we can make such tremendous difference. And the
Mhm.
research is there to support it.
Mhm.
Absolutely. Um,
So do you only service seniors? That was another question I had too. Do you only service, I know you don't, Sue, you do all
yes.
different populations, but Lindsey, do you only service seniors, or do you also take like workers' comp clients, or, children, pediatrics? Or do you just do seniors?
Um, I started out doing only seniors, but I do have the ability to see all ages of adults now because of the different insurances that I've credentialed with. And I take Medicaid now too. So I see all ages of adults, whatever they need me for. If they need me only for PT, if they need me only for a home modification, whatever it is. Yep. I don't see pediatrics because it's just not my specialty. So,
Yeah. Okay. Okay.
yeah.
Whereas in my rural areas, as you know, Alyssa, that
Yeah.
was a big need, and it ended up becoming more than a third of my practice
Hmm.
because, you know, and then young adults who had aged out of the school district.
Hmm.
Definitely because again, there was not the services available, and most of them were Medicaid. The thing is, when you're structuring a business, and we talked about that, we just have to look at what's survivable in terms of geographic travel and in terms of how much you're getting reimbursed. And I know Lindsey, you or your husband helps you calculate those things, right? To make sure you're surviving business wise.
Yeah.
I remember those discussions.
Yep.
So definitely, hang on one second, I think. Do all of your services require a doctor's order? So, Lindsay, I'm going to let you answer that first, and then I'll give the other answer.
So, the short answer is yes. If it's not a private pay and you are billing through insurance, there has to be a doctor's order. Depending on the state you're in, there's something called direct access where, and they have this in Michigan, so I use this quite a bit. If they come to you and they need therapy, but they don't have a doctor's order yet, um, you can start for 30 days while you obtain that or help them obtain it. So, short answer, yes, but there are ways to work around it.
So I think, Lindsay, you brought up a couple of things there, right? One is, what are the payer rules and what does your state licensing practice act require? So those are all things that come into play. And for each of us, that's going to be different in each state. For example, in Washington State, I can take an educational referral, I can take other referral, but if it's a medical case, I can do an assessment and then have to get a doctor on the team and as part of that process. But Medicare doesn't really require a doctor's order now initially, but the doctor needs to sign off on your plan of care. You really want them on your side in the first place, right? And you don't just want to give them a plan of care and them going, who are you? And what is this about? So thinking about part of that team player, and then each of the other payers has different requirements. For example, Medicaid in my state did require a doctor's order, and they almost removed all therapy coverage for adults last week, and we fought against it and actually have just been announced that we've kept therapy services for adults on Medicaid in Washington State. So, there are all those players, Brittany, that come into play that you need to understand. And we help you look at all of those as you go through that process. All right, any more questions? This has been a great discussion. If there's no more, thank you all for attending. And Lindsay, thank you so much.
You're
And
welcome.
I am just so proud of where you've come in these 3 years as you were thinking about putting this together. And now you are answering these questions amazingly. You've done a great job with organizing your practice. And now, having hired staff and managing all of that component as well.
Yeah,
So
it's been a long road. It's been tough, but you've been extremely helpful in it. So,
Lindsay,
Rita,
I want to tell you that you give me a little bit more hope right now because I was pretty hopeless this last year. It's so hard as a coder trying to figure it out. And one of the things that I'm concerned with is the whole eval practice. You know, um, going through that and making sure my OT is doing what she's supposed to do. I mean, I guess that maybe doesn't make sense, but it does to me in a way because I own the business. I kind of want to make sure, I kind of want to be knowledgeable about everything,
yeah,
you
you're going to
know.
be a little more critical of your OTR as a business owner
Mhm.
would in just like
Yeah.
a clinical setting where you're just the OTA. Yeah. So it's definitely difficult, but keep going with it. And I'm available for questions anytime you want. So
Okay, I really appreciate that. Thank you so much.
you're welcome.
but I think, Lindsay, you've really highlighted there that, as an OTA in this business, you play two roles, as we talked
Mhm.
about before. One is the business owner, ensuring what happens, and then one is the OTA working under the OTR. And so while that seems difficult for you, I'm going to say for all of the other therapists here, as OTRs, we don't often get that realization as quickly. And we get stuck in the OTR role and don't assume the role of the business owner as well. And so once we start owning a business, we have different perspectives as the business owner as we do as the therapist performing the therapy services. And so those are key things to take into account as you do this. And that's why having a support group that helps you look at those business owner responsibilities and things is really helpful too.
Yeah, absolutely.
All right. Well, thank you all so much. Have an amazing evening. And Lindsey, thank you again.
Yeah, you're welcome.
Great.
It was nice to meet
Thank
everyone.
you. Thank you.
Thank you so much, Lindsay.
Thank
All
you.
right. This is going to be posted on YouTube, and it will also be going into our podcasts. So if you want to listen to it again and go through the stuff, you'll be able to access it there.
Oh, great.
Okay,
Thank
great.
you.
Thank you.
Take care. Bye.